was for a lot of tugging.
I want you above, Dr. Fuller. I want someone else.
Giving birth is risky business.
There was nothing that could be done. You know, everyone was trying to get this baby out.
Come on, Vic, straight down before. Right here.
From the excruciating physical pain
Hi, sweetheart.
Oh.
to those final moments when things can go from triumphant to devastating in a split second.
We can't just keep, transfusing her.
In the high-risk unit, every birth is a minor miracle.
I never thought I'd have my baby.
Okay. Blood bleed out. Here we go.
And a major milestone for special deliveries clinging to life. In the Mountain States, Denver's Presbyterian St. Luke's Medical Center is the first stop for high-risk mothers in need of life-saving miracles. Mothers like 22-year-old Keisha Jenkins.
I am 32 weeks pregnant, and it's been about 6 weeks in the hospital.
At 26 weeks, she learned her baby's life was in danger because of a cord prolapse.
A prolapse cord is where the baby's head is laying on top of the cord at the very bottom of my cervix, and he's able to come out at any time, and the cord will probably choke him and kill him.
If she were to labor, the cord could be compressed at any time, and the baby's heart rate could drop, and we could need to C-section her immediately.
In addition, Keisha has been experiencing preterm labor, and doctors have been giving her powerful medications to stop the contractions.
My term here for these ladies, I call them time bombs. They're just waiting to go off, and you just hope that you can get them a day further. She could go any time.
Unfortunately, this morning, Keisha's contractions broke through the meds, and now it's too late to try to stop them. She needs to have an emergency C-section.
We want to be urgent about it because if the baby's head drops onto the cord and the cord gets compressed, that supply is cut off to the baby. You can get brain damage, and the baby may not make it if it doesn't have that life supply from the placenta.
One more second. Call nursery.
It's a dangerous situation. If she doesn't deliver, the baby could die in utero.
We're scrubbed and ready to go.
If he survives the delivery, he's still 8 weeks premature. Keisha and her baby are in a battle for their lives.
We're ready, guys?
Every day is another milestone for 23-year-old Vicki Lowe, who is carrying twin boys.
I wasn't high risk before, but now I am because pretty much at any time I could go into labor.
Any dizziness at all?
A month ago, her cervix began to soften, and her baby's lives were at risk. She was airlifted from the medical center of Aurora and kept on strict bed rest. It worked. So far, she's made it to 33 weeks.
We are going to the pool. We have to go in wheelchairs because we are not allowed to walk.
Pool therapy is the only time Vicki can get out of bed.
It's just nice to get out of my room and speak with other women who are in the same position as I'm in. I really like it.
I think most people do, if nothing else, just to get out of the bed for a while, huh?
Oh, yeah.
Vicki's situation is tenuous. Her baby's lungs are still immature, and her doctor wants to keep her from delivering for at least another week.
Do you have one baby on board or more than that?
Two.
Two?
Twins, yep.
Cool.
A team of doctors and nurses are trying desperately to deliver Keisha Jenkins' baby.
Are you okay, Keisha?
Okay.
But there's a problem.
The nitroglycerin is helping. If I could get a hand from below. Here, Dr. Fuller, we get you right in the back.
I was for a lot of tugging.
Although only 32 weeks pregnant, Keisha's contractions were so strong that the baby began to navigate the birth canal.
I want you above, Dr. Fuller. I want someone else helping a hand from below.
And now her doctor can't get him out.
They reached in to grab the head, to pull the baby out. The baby's head was trying to come out the birth canal, and the head was stuck.
Can we have another nitro?
100 Carrie Harkin is 34 weeks pregnant.
There's a little eye socket right there.
Today, she is having an amnio to determine if her baby's lungs are mature enough for delivery.
Some fingers. See the 4 little finger clubs right there.
Carrie can't wait till term.
Give me a little syringe first, please.
Because her baby has a serious intestinal disorder.
Gastroschisis is when the intestines don't form inside the body. They form on the outside. And after they're born, they have to do a surgery to place the intestines in the body.
Gastroschisis occurs in about 1 in 10,000 live births. There is no known cause, and surgery is the only solution. The longer he stays in the womb, the greater the chance his exposed intestines could become infected by the amniotic fluid.
I cried because the fact that my baby had something wrong with him. I wanted to have the perfect pregnancy and the perfect baby. It was a shock.
For Carrie, this pregnancy is very precious.
I've had 3 other pregnancies and I've lost all 3 of them due to incompetent cervix. I never imagined trying to have a baby would be this hard. Never. I always thought that it was easy. I've seen other women do it and they had the perfect pregnancies. And
Finally, for Carrie, some positive news. Her baby's lungs are mature, but once he makes it through the C-section, his battle will be just beginning.
Suction, please. Suction, please.
There's tension in the OR as Keisha's C-section hits the 10-minute mark, more than twice what it should take to deliver this baby by C-section.
You lift as much as you can.
You're like, okay, this baby's head is gonna come out, and it wasn't. That was when the minutes turned into hours.
Keisha's baby's head is wedged in his mother's birth canal.
There was nothing that could be done. You know, everyone was trying to get this baby out. So Dr. Stam ended up reaching into the vagina and just pushing that baby as far as they could. And then they ended up cutting the uterus a little more so that they just had more room.
Finally. But this baby is in trouble. He's not breathing, and he's not moving.
Open the epi. Open the epi.
I want to hear him cry bad, very bad.
Keisha Jenkins' baby is barely a minute old, and he still isn't breathing.
You only get one chance to be born, and that's why you really need to be able to resuscitate these kids. Those first 5 minutes of life are very important.
They started suction the mouth, gave immediate oxygen by a mask, and established respirations, and then put a breathing tube down and basically gave some epinephrine down the breathing tube, as well as doing a cardiac massage to make sure the heart rate was within an acceptable range.
He's coming around. Yeah.
Finally, a small sign of life.
Heart rate's good.
Okay.
How old is the baby now?
Probably about 2 minutes of age.
This baby is headed for the NICU. But first,
And we're gonna wrap him up and let him mom hold him for just a minute.
Okay, here he comes. Right?
Now the stuff that you hear, that's surfactant that we gave into his lungs.
Okay.
Okay? You just need a little jump start, okay?
All right.
What are we gonna name him?
Cameron.
Cameron? Okay. I'm gonna take really good care of Cameron, all right?
Okay, thank you.
We'll come back and tell you how much he weighs.
Cameron Jenkins is almost 2 months early.
4 pounds. 2.
But he's lucky. After being stuck in his mother's womb for close to 10 minutes, he's alive.
The condition that she had has very high fetal mortality. In some centers, up to 80% of those babies die, and it's just, they're tough deliveries. And they can go not very well real quick. I think it's about the best we could have done.
To keep Cameron alive, 2 catheters are inserted into his umbilical cord.
We can draw blood from the arterial catheter, and we can give like the sugar water and stuff through the venous catheter.
Within minutes, Cameron starts to respond.
Now we'll just kind of get him settled in his bed here, and we're going to give him some volume because his blood pressure is a little low. When he first came in, he was being bagged with 100% oxygen. You and I breathed 21%, and he's in about 30% now.
After the delivery, doctors see just how lucky Cameron was.
He could have died at any time because of that knot. If that knot would have tightened, then his supply to life is cut off. So he's amazing. I mean, he's absolutely amazing that he's alive. I know he has an angel watching over him.
It's been 6 long weeks since Vicki Lowe was ordered to bed rest.
Can you feel my fingers?
Finally, today, Vicki hears those magical words.
Okay, let's get these membranes ruptured if we're gonna get this done today, huh?
Yeah, I'm ready.
Somebody might call her 5, but I'm gonna still call her.
You're gonna.
I'm gonna call her 4, but somebody might call her 5.
Oh, okay.
Even though she's planning a vaginal delivery, Vicki will have to deliver in the operating room, a precautionary measure with all multiple births.
There's always a small risk for that second baby will misbehave, and we need to be prepared for that second child. Sometimes they don't come out like peas in a pod, and so they need to be in an operative setting. Okay, you're ruptured. The show's on the road. It's 10 o'clock.
In a matter of hours, Vicki hopes to be cuddling her twin boys.
Between ultrasound patients, Vicki.
Okay, okay.
But it won't be that simple.
You nervous?
Little bit, but...
After 39 weeks and 4 days, Holly and Joe Sepulveda are about to have their first child.
Today I am here for a cesarean section, and just because the baby is breech presentation, and he has been for the last week.
But even if the baby wasn't in a breech position, doctors would have opted for a C-section, not because of the baby, but because of his mother.
I'm going to take the 5th on my weight at this point, but I am a big girl, so, and I have to work on that after the pregnancy is over with.
Holly's last weight was 418 pounds, which puts her in the morbidly obese category, and that puts her in a high risk of many complications, both for the pregnancy as well as for the delivery, and obviously with surgical risks as they are, a much higher risk of surgical complications.
So far, Holly has had a relatively risk-free pregnancy.
None of the other things that they thought might happen have happened, like the preeclampsia or gestational diabetes. And if anything, my blood pressure got better with the pregnancy. They used to tell me, you could sell blood pressure like that, so. So I was always pleased to hear that.
Is this on right?
Dr. Sepulveda to ER.
Still, Holly's C-section will be anything but routine.
There's some challenges as far as putting an epidural or spinal in someone that is overweight. There have to be special considerations as far as where to make an incision, as well as how to get the baby out and management of bleeding after delivery.
But all in all, Holly has reason to celebrate this day. She's a thyroid cancer survivor who never thought she would conceive.
It's like starting over again. I really do get to live, you know, from that experience, and I'll be here to take care of him, and I think it's one of the first times since that happened that I really felt like I really do get another chance. I'm ready. You look gorgeous. I know, don't I look gorgeous? This is my big day.
The beeping of a fetal heart monitor is music to Brandy Cooper's ears.
Yes, that's the heartbeat. It's an incredible sound, knowing that he's in there.
It's even more reassuring because Brandy herself has a serious heart condition.
I have a condition that is called aortic stenosis. My valve is deformed, too small to allow blood to flow properly through my body.
The aortic stenosis was discovered when Brandy was 20 weeks pregnant. 3 weeks ago, her doctors insisted that she spend the remainder of her pregnancy in the high-risk maternity ward.
Pregnancy puts stress on the heart, so it works harder when there's two of you. So they're concerned about cardiac arrest.
Patients can have heart attacks, they can have strokes, so it can actually be quite severe.
I thought I'm too young to have cardiac arrest. I didn't think it could happen to someone at 26 years of age.
Brandy was born with Turner's syndrome, a genetic disorder which affects 1 out of 2,500 baby girls.
Turner syndrome is the opposite of Down syndrome almost. Instead of an extra chromosome, you're missing one. Mine is called what is called mosaic. I only have it in a few of my cells. When I was genetic tested, they found it in 7 out of 30 cells. And that's the reason behind my heart problem. Turner babies have heart problems.
Hey, how are you? Good. How's it going this morning? Everything fine? How's the baby moving today? Good. Yeah?
Tomorrow, Brandy is scheduled to give birth by C-section, but it won't be an ordinary C-section.
For the C-section, it will begin at 8:30, okay?
Okay, that's not too
So you'll have the baby shortly after 8:30.
This C-section will be taking place in the main OR with a cardiac team standing by. Unfortunately, that means her fiancé, Jeff Lovato, won't be able to attend his son's birth.
Now, he plans to put you to sleep for this, right? Completely asleep. So what you can do is wait outside, and then when she's asleep, we'll come out and get you, and you can come in. It's a little scary to see at first, so I'm just going to warn you. She will have a breathing tube down her mouth and by the windpipe. I think at this point, Brandy is finally realizing the severity of her disease.
If my heart has problems during the C-section, they'll do the valve replacement right then and there.
In the event that your heart doesn't tolerate the fluid shifts that are associated with the delivery, Dr. Young and his entire team will be there to do your valve replacement right after delivery of the baby. We've been concerned about Brandy throughout the pregnancy, and we're happy that she made it this far without her heart failing. And so, you know, the major risk is that during the surgery, her heart could fail, and if the valve replacement is not successful at that time, she could die.
I always thought I'd have a full-term pregnancy with a normal delivery. It just didn't turn out that way for me.
If she can survive the C-section, Brandy will need to replace her weak valve as soon as possible. In this case, 4 days after delivery. There's a lot at stake in the next 24 hours. Today is the day that Carrie Harkin will finally deliver her baby boy.
And so we'll get you on the monitor, do your vitals, and then Shelly's going to start your IV.
Doctors say she's ready.
Did you sleep last night? Not even a second? Uh-oh. We have to have lots of Kleenex for you.
But Carrie's not so sure.
I'm not ready for this.
You are? Okay. Get him one of the anesthesia doctors here of you. Make sure everything is fine.
Okay. I'm not ready for this. I'm not ready for this. I just want to go home. I'm just scared. I'm just not ready. I know he's safe inside me.
But he can't stay there. And once outside of the womb, Carrie's baby, with his stomach and intestines on the outside of his abdomen, will face a world of complications. It's time for Carrie's baby to be born. The time has finally come for Vicki Lowe to deliver her babies.
The A is well down, about +1 station, and she's almost complete, 9 centimeters. I got a feeling with a little bit of help, she can get this baby down where we can help her out with it. So we're going to look for an assisted vaginal delivery.
There's another reason for the urgency. Baby A's heart rate is slightly decelerating with each contraction.
I just think we're kind of being prepared. See if we can get this done before something significant happens. Right now, it's just little pink flags. Make it happen, kiddo. Come on, push straight down to the floor. That's it. Excellent. 4, 5, excellent. 6, 7, 8, 9. And again, real quick, don't let her back up. And push hard. Push, 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 push. Keep it coming. You're doing good. She's coming. 7, 8, 9, 10. Be careful. Okay, are you using this internal at all? You guys just getting close for this first one, okay? I'm helping you.
Okay, you ready?
Come on now, let's see you make this happen. Come on, Vic, straight down to the floor. She's right here, she's climbing up. Look at that. Push, 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 push.
One more.
Curl into it and push straight down. Come on, Vic, straight down to the floor. She's right here, she's climbing up. Look at that. Hi, sweetheart. I got you.
At 5:45 p.m., 8 hours after induction, Caleb Vincent makes his debut.
Now, we're not done yet, kid. We got 2, as I recall.
Yes.
Yep, yeah, let's go.
He's back.
Take it very down here.
Do it. Come on, push, 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 push. Awesome.
Come on, Vic. Push, 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 push. Oh, this is nice.
Oh, beautiful. Watch out.
Hi, sweetheart. Hey. Oh, he bounced right into that thing.
It's all over. They're here. They're here.
He looks different, doesn't he? He looks different.
7 minutes later, Caleb is joined by his brother, Colin Victor.
It's fantastic.
I'm so excited.
Just take a deep breath. Okay.
Good separation, except a little small episiotomy.
Yeah. Hi, Caleb. You're so precious.
Oh, here's the next one. Pick up this hair next to you. Get them both.
Why don't you see what happens?
Hi.
You want to do more than just gentle?
Yeah, why don't you see what happens?
For Preemies, Caleb and Colin are doing remarkably well.
They look a little different, I think.
They do. They're not. I don't think they're identical.
I'm very happy.
But something is terribly wrong with their mother.
Oh, something's happening. Oh, geez. Something good. Strong. I'm going to put another pack in, so that uterus should be... Give me some laparotomy sponges.
Vicki Lowe just gave birth to 2 healthy boys.
Oh, so good.
I'm almost done repairing this now.
Oh, jeez.
And now she can't stop bleeding.
I need somebody to do what I'm doing. You got to get on this uterus and feel the whole thing.
The condition is called uterine atony.
Come on, uterus. Give me a break.
Her uterus isn't contracting and the blood vessels won't close. She could bleed to death.
Cindy, would you call 6522 right here?
Yeah.
Find out who's on for interventional. Tell them, give them a heads up. Tell them there's a chance that we might want them to embolize.
Right now, the most important thing is to stop the bleeding. Doctors are vigorously massaging her belly to get her uterus to contract. She's also being given medications to promote contractions.
You need to be prepared for these things. You need to be stay ahead of the game, medicine-wise, blood-wise. You don't want to get behind. She's been transfused. 4 units of packed red blood cells and 2 units of fresh frozen plasma.
The 4 units of blood equal almost half the amount in the human body.
This is the liquid part of the blood, not the red blood cells. This part doesn't carry the oxygen. It just has clotting factors, and since we need her blood to clot here, we're giving her this part.
Her doctor is calling the radiology department to stand by in case the bleeding continues.
Tell them that we have a lady that we think is not a 100% candidate, but close. I'd say better than 50-50.
They would inject particles into Vicki's uterus, a procedure called embolization.
I told the father that we might have to try to embolize this uterus to quiet it down. I don't think fertility is her big issue right now. She's got 2 little twins in the nursery.
If that doesn't work, the last resort for this young mother is a hysterectomy. Hopefully it won't come to that.
We're going to give her 30 minutes to stabilize. So she, I mean, we can't just keep, transfusing her. We got to put an end to this one way or the other. And I think embolization is a good plan if she won't stop on her own here.
I'm going to see my baby for the first time to the nursery in the NICU unit.
Excited?
I'm very excited. I can't wait to see what he looks like.
Cameron Jenkins is 1 day old.
Oh, look at him. Oh, he's cute. Oh, my goodness.
And for a 32-week premature baby, he's doing remarkably well.
Oh, he's gorgeous. My little man.
He is not on any medications. No oxygen. He has got a tube that's going in through his nose and down into his tummy. We're feeding him that way.
I'm so glad to see him, and he looks like he's doing well. I'm excited. I think I'm gonna have my hands full when he get older. Oh my goodness. He's so tiny. I went through so much.
Because of his status and small size, he will probably be in the hospital until his due date, about 5 more weeks.
Thought he was gonna I didn't think he was gonna make it at all because of the way his umbilical cord and stuff got tied. And he came out and they finally got him together and got him stable, and he was good to go. He was good to go.
24 hours ago, Keisha didn't know if her baby was going to even make it into the world. Today, she is looking into the tiny face of her very own special delivery.
Hemostat. Now, as your baby's being born, you're going to feel a lot of pressure up here.
This is the moment Carrie Harkin has been anticipating and dreading since she learned her baby had gastroschisis.
How you doing, Carrie?
I'm doing good.
We're doing good here. We're getting close to having a kiddo here, another minute or so. I think we got it, Dell. Hey, sweetheart. Hi, sweetheart. Looks pretty much like it did on ultrasound, Carrie. Don't drop it.
The tiny newborn is rushed to the baby warmer, where neonatologists take over the task of stabilizing the baby and protecting his exposed intestines. Halen Harkin is small, weighing only 3 pounds 15 ounces, due in part to the gastroschisis.
It's quite stressful for the child, and anything that puts extra stress on the baby will restrict its growth as well.
I think on the small guys, they always end up on the blower after a while. And he's not doing that great anyway. Probably around 17.
They went ahead and intubated the baby, which means they put the breathing tube down the baby's throat, let the machine do some of the work of the breathing so that at least that was protected. That allowed us to give some drugs like morphine and Versed, which is a Valium-like drug, to let the baby relax and not feel any pain as we manipulated the abdominal wall. Some surgeons will take the baby right to the OR, use a lot of pressure, and push those intestines right back in right away. And that works for some babies, but for some, especially that are so small like this, that puts a lot of pressure inside the abdomen. And the abdominal cavity itself is smaller than it would have been normally, so there's not as much room anyway.
When there's no room, the intestines push on the lungs, impairing the baby's breathing, and push on the kidneys, affecting urine output.
When both of those things happen together, that's called abdominal compartment syndrome, and we like to avoid that if at all possible. See how swollen they are and inflamed? They shouldn't be red and angry like this, and that's just from being exposed probably to the amniotic fluid. That will go away if we just give it a little bit of time and protect it. This is a silicone bag. It's waterproof and water vapor proof, and this little spring loaded part is going to go underneath the abdominal wall. We're going to just slide that right up underneath there so that goes through the defect.
Once the silicone bag is in place, doctors suspend it above the baby so that little by little, gravity will help the bowels descend back into the abdominal cavity.
Then in about 5 days, we'll take the baby to the operating room and we'll close that defect. In general, babies with gastroschisis are free from most of their defects and do pretty well.
I can't wait till he's running around. Oh, he's going to be a big boy.
The medicine worked, and Vicky's bleeding has slowed down.
Well, we're going to see what her blood count is. I think we're fine right now. It depends how much more she bleeds.
She won't need a hysterectomy, but right now, Vicky is still too scared to feel relieved.
What?
I thought it was going to bleed to death.
No.
Like we were losing so much blood.
No. We knew this was going to happen. We were all ready for you. Now I'm going to call the radiologist and say they're not off the hook, but their risk is going way down.
Okay.
Okay.
On this side, we've got an AC over there that you're.
Stop it.
I know. Just trying to relax.
While Vicky is in recovery, her twins begin life in the NICU.
So far, he's breathing on his own, and he's not requiring any oxygen.
Caleb Vincent is a healthy 4 pounds, 14 ounces.
They're just Jim Dandy, perfect in every way.
While Colin Victor weighs in at 4 pounds, 12 ounces.
I think we'll watch them through the transition period for the next, 3-4 hours maybe. And if they look okay, then, and everything looks fine, then I think we can let them go out to the regular newborn nursery.
Hi there. It's good to be a twin bee, isn't it? Driveway plowed and all that.
Yeah, it's been good.
That's wonderful. They look great.
They do look good.
Great.
I'm gonna go see Halen for the first time. Go and see him and see what he looks like and how he's feeling.
Halen Harkin has been immobile for the past 24 hours. His intestines slowly descending through a silicone bag back into his abdomen.
Hey, baby. Can I touch him?
Oh, certainly.
And now that she's finally seen him and touched him, Carrie, like any new mother, is hooked.
He's so tiny. He's absolutely perfect. I never thought I'd be able to have a baby. And now I have my baby boy. He's perfect to me no matter what. No matter what, he's just the most perfect thing.
Love you too.
It'll be good, guys.
You'll be fine. We'll have a little baby.
Family member. I'm pretty nervous, very nervous.
Okay, we'll see you guys.
Brandy Cooper is on her way to the OR for her C-section and a possible heart valve replacement.
Be okay, okay?
First of all, they're going to put her to sleep. Once she's anesthetized, we'll go ahead and deliver the baby and then decide if her heart handles the operation okay. And if not, she'll have a valve replacement today.
Because of the precarious situation, Brandy's fiance can't be with her in the OR until doctors know for sure that Brandy's out of danger.
She's gonna have the tape over her eyes and the breathing tube in her throat and all these wires and gadgets hooked up to her. And it's gonna be scary. And I'm hoping I can actually handle it.
Hi, they're ready for you to come back now. And so we're peeling the bladder back.
Hold on, Frank. Okay, knife. And getting into the uterus here. I want to be careful not to cut the baby. Bladder blade out. Here we go. Suction. Hey.
Yeah, look what we found.
Here we go. She's got a boy.
Sounds pretty vigorous for anesthesia, doesn't it? Get some port gas.
Jeff, congratulations.
Thank you.
Tyler Lovato's delivery runs smoothly.
He's beautiful. Whoa, buddy.
You gonna wake him up?
You're a mover, huh?
And the cardiac team is no longer needed.
She looks fine. Her blood pressure and pulse have been very stable throughout the whole procedure. We'll plan to do her aortic valve replacement electively on Monday, 4 days from now.
He's just beautiful, Dad. What's his name?
Tyler.
Tyler. Happy birthday, Tyler.
He's very cute.
My beautiful baby.
That's right.
Went great. She did very well. Great baby, and heart behaved very well, so we're happy. She's going to recovery now and then to the ICU after that? Yeah.
Brandy will spend the next 24 hours in the intensive care unit. Then she can see her baby for the first time.
It's okay, my son. It's okay. It's okay.
But Tyler's premature birth may have created some problems for the newborn.
This is baby A, this is Caleb Vincent, and that's baby B, and that's Colin Victor. Are you getting
24 hours ago, Vicki Lowe thought she was going to die.
I was losing a ton of blood and my body was just pretty much in shock. I was shaking uncontrollably and was running a fever, and it was just a really bad mess.
Today, she is just getting used to the reality of her new life.
I cannot believe they're here, and I still cannot believe they're mine. I still look at them and think, wow, I made these two little guys.
Over the past few days, baby Halen's intestines have slowly descended back into his abdomen. And today, he's about to undergo major surgery to close the gaping wound. Carrie and Jared, who have waited so long for this baby, are having a hard time letting him out of their sight.
Okay, we'll take real good care of him for you guys. And like I said, we're going to go right from here, right up to the 3rd floor.
It's been 6 days since the baby's been born, and the intestines are almost completely reduced back into the abdomen. His abdomen is also stretched out quite a lot. So we're going to finish the reduction, and then we're going to attempt to close the fascia.
Once the abdomen is sewn up, Halen's surgeon inserts a Broviac catheter through his jugular.
We should be able to draw blood out of that and give him his nutrition through there. Then we'll have to stab him anymore to get IVs in him.
3 hours later, it's all over.
Now the baby will go back to the NICU, and we'll stay on the breathing machine for at least a few days. And we'll wait for the intestines to sort of wake up. I think it's going to take this baby about 3 weeks before we can really start a diet. Now we'll go tell the parents the good news. We're all done. The baby's he's on his way back up to the NICU. You can expect that the baby's going to stay on the ventilator for a few days still until the abdomen gets a lot softer. Just wait up there.
Thank you so much for everything.
Well, thanks for letting me take care of it.
For Carrie and Jared, another hurdle cleared.
He's out, and his intestines are in, and it's just a couple more steps now.
The next step? For this new mother to finally hold her special delivery.
And
this little thing was inside me.
After spending the past 24 hours in ICU, Brandy Cooper is finally experiencing the ultimate joy.
I'm sore. I'm very sore. But he's worth it.
In the first few minutes of life, doctors noticed that Tyler had trouble breathing. An X-ray showed a possible lung infection. He was immediately put on antibiotics.
Once he's off the nasal CPAP, breathing on his own, and not having periods of apnea where he forgets to breathe, he'll really be well on the road to recovery and, for the most part, considered out of the woods.
It's amazing to love someone this much that you just saw.
Brandy is relishing every precious moment alone with her new baby. Because in 2 days, she'll have to undergo her valve replacement. It's major heart surgery, and she may not make it.
It's gonna be real.
Almost 40 weeks into her pregnancy, Holly Sepulveda is about to have her baby, and the prospect elates and terrifies her at the same time.
Oh God, I don't want to do this.
She's just having a little bit of an anxiety attack.
Oh,
We're fine.
I'm sorry.
Because of her size, Holly's C-section is a challenge to the OR staff, requiring a special surgical and anesthesia plan.
A bit more difficult to maintain an airway on an individual that has significant amount of tissue in their neck area. So from an anesthesia standpoint, that's kind of what we need to be concerned about. From a surgical standpoint, what we'll do is go ahead and make sure we have appropriate instruments of a proper length to reach where we need to go for the surgery.
Even Holly's incision will be adapted to her size. It will be high and vertical instead of low and horizontal.
Those incisions are fraught with a lot more complications, a higher risk of wound infections, much more difficulty getting to the baby. It's a much more difficult surgery to do. Those who have researched obesity and pregnancy extensively recommend making the incision above the uterus. And for her, above the uterus and above that lower portion of the uterus where we need it to be was above her belly button. It's a much more challenging, much more complicated surgery than a routine cesarean section is.
She's doing fine. Her vital signs are stable. We got the catheter in. She's just really anxious. She'll be glad to see you guys.
Yeah.
Good to go.
Oh God.
It's all right. You're not feeling anything, are you?
No.
Just some tugging, right?
I don't even feel that. I'm just overwhelmed.
They're opening the uterus right now.
Oh God.
Yeah, they're opening it right
I
now.
don't feel it.
Perfect.
Yeah.
With her mother and husband standing by, Holly Sepulveda is minutes away from motherhood.
I am so glad I don't have to see this.
You got time, you got time.
Okay, now you're going to feel some pressure, and this is going to be tough, okay?
Okay.
You're all right.
Okay.
Okay, now this is Dr. Preemies pushing that baby out, okay?
Okay, I don't feel anything.
By manually pushing above the uterus, doctors can generate pressure to make the baby come up through the incision. But Holly's baby isn't coming up.
That's frequently the case in individuals that are overweight.
Doctors have to resort to a vacuum to suction the baby out, the same vacuum they use for vaginal deliveries.
You know when it's up, take it all the way up. Hi, sweetheart. We found you. We found you. There's the baby, Holly, look.
Oh my God.
What, is it hurting?
No, I heard him cry.
Leg up.
He's real.
He's beautiful.
For this cancer survivor who never thought she would ever conceive, John Matthew Sepulveda is truly a special delivery.
Congratulations. There you go. Got a hold of him? See you better later.
Oh,
that's okay.
It's okay.
You cough it up.
It's okay, sweetie.
Today's a big day for Carrie Harkin. She gets to hold her baby for the very first time.
It feels good to hold him. put you at ease to be able to pick him up out of the bed finally.
It's been a long and emotional journey for this young mother.
He's doing really good today. They're lowering his oxygen. So he's breathing 21% oxygen, and they're lowering the medication. And pretty soon, hopefully, we'll have all these tubes out of him. We'll get to feed him, hopefully really soon.
Halen won't go home for another 8 weeks, but with their special delivery wrapped in their arms, the Harkin family is finally complete.
No words can explain it. I mean, there's nothing you could say. It's the best feeling I've ever had in my life.
She said she's never been in such love before.
I think it's like the best day of my life.
John Matthew Sepulveda spent the first 3 hours of his life in the NICU. Because he was delivered by C-section, he had excess amniotic fluid in his lungs.
They gave him what we call a therapeutic bath, just to, we really want to get them crying, because the more that they cry, the more the fluid will come out of the lungs, and the lungs will fill with air. So after they gave him a nice bath and got him to cry, he seemed to be breathing a lot better on his own, didn't require any oxygen, and then he was transferred here to the level 1 nursery. He's doing great. His vital signs are stable. His respirations are great. He's breathing on his own. He's bottle feeding, and is wonderful. He's doing great. He can go and be with his mom at any time.
He's just the little heartbreaker of the nursery, and I'm doing really well as well, and getting up and walking around and passing all my tests too. So we're just doing fabulously.
But now with a baby to take care of, her doctors say that Holly has to make some serious lifestyle changes.
Holly has some medical issues that she needs to deal with at this point, and I think she's motivated to do that. I mean, this young baby is great motivation, as it is for all of us, to improve our health care so we can spend a long, healthy life raising our children. There's long-term cardiovascular effects from carrying that much weight that need to be dealt with.
And being able to care for their special delivery has become priority number 1 for Holly and Joe.
What's next for us, Joe?
I don't know. I guess just take him home and raise him the best that we can. And hope that he grows up to a good person.
Yeah. You have to come and see us when you're and able to get out.
Oh yeah, I'll be up and see you.
Give me a hug. Good luck. Thanks.
Today, the nurses in the maternity ward say goodbye to Brandy Cooper.
Good luck, good luck.
Brandy's on her way to the cardiac floor.
You ready?
Just 4 days after delivering her baby boy by C-section,
You have to, baby.
she's headed back to the operating room for a critical valve replacement surgery. It's a procedure that could save her life.
Don't cry. If something happens, nothing's gonna happen to you.
Or cost her life. 5% of heart valve replacement patients don't make it. For fiancé and new dad Jeff Lovato, the next few hours will determine the future of his young family.